When it comes to stroke, there is a big misconception that only seniors are at risk, but the reality is people of all ages, genders, and ethnicities can be affected. So what, if anything, can you do to decrease your risk? Joining me now are neurologists Dr. Hamid Sami and Dr. Jocelyn Montanye from MidState Medical Center. It's great to have you both here with us.
Thank you.
Thank you for having us.
First of all, talk about the difference between a stroke and a heart attack. Let's define what a stroke is.
So a heart attack is when there's an area of lack of blood flow to the heart from a blood clot. Well, a stroke is similar, but this is when there's lack of blood flow to an area of the brain. And that can be from closing off a blood vessel in the brain or a blood clot coming from the heart or somewhere else. And that causes damage to the brain from lack of blood flow. Sometimes there are strokes that have similar symptoms that are from bleeding in the brain. But when people use the word stroke, we're often talking about lack of blood flow being a blood clot.
Well, how do you know you're having a stroke then versus a heart attack?
You know, there are certain symptoms patients can have, like sudden onset face droop, sudden onset arm or leg weakness, sudden onset severe vertigo, sudden onset walking difficulty, or
so that's
vision
different from
loss.
somebody having a heart attack?
Heart attack, usually people present with chest pain, sometimes left arm numbness, tingling, but symptoms of a stroke could be completely different.
Very good. We'll talk more about that later on in this conversation. Let's talk also now about the risk factors. And we can refer to some of them as modifiable risk factors. And what do we mean by that?
Some means, you know, some risk factor that you can control, and there are certain risk factors that you cannot change or control with a healthy intervention, like non-modifiable risk factors such as age. People, you know,
can't control that.
Yeah, above age 55, or in some studies showed in some races like African American, they are more prone to have a stroke, or male gender. And then there are some non-modifiable risk factors such as hypertension, smoking, high cholesterol, diabetes, sometimes even obstructive sleep apnea can be associated with stroke. In females, sometimes hormone birth control pill or hormone replacement therapy can be associated with a stroke. And
so if you address some of that, can you reduce your risk for having a stroke?
Most certainly. High blood pressure is something we see frequently, and it's a big reversible risk factor. Now, the blood pressure itself, that diagnosis of hypertension doesn't go away, but controlling that high blood pressure over the long term is key for decreasing risk for stroke. And the same thing goes true for high cholesterol, diabetes. Controlling the sugars is very important. And a lot of these all come back to weight as well. You know, if someone is overweight, the risk for stroke is higher. And by controlling the weight, blood pressure is better, blood sugars are better, cholesterol is better. And so that overall makes people a lot less risk for stroke.
All right, so let's talk more about the warning signs for stroke. We discussed some of them already. You said the face is droopy, the arm, leg suddenly weakens, speech difficulty. What are some of the other signs that people should be looking for?
Sometimes sudden loss of vision in one eye, sometimes severe vertigo, sometimes severe new onset headache that they never experienced before. And also, as we discussed, you know, sudden onset face, arm, leg weakness. These are all symptoms of stroke that people have to pay attention and call 911 immediately.
That's the
because
key.
Time is brain.
Absolutely. The quicker you can get to the hospital, the better you can get treatment and be able to survive. Isn't that right, Dr. Montanye?
That's true. So we do have the ability for people to get to the emergency room quickly after the onset of stroke to administer some medications that can break up blood clots. But they're very time critical, so being able to administer them as soon as we can to the onset of symptoms, and actually if it's been too long, we can't use the medications.
That's right. There's a time frame. Is it like an hour or within 2 hours?
It's up to 3, and then in some people even up to 4.5. But that's, you know, that's from onset. So it's very important to get to the emergency room right away.
Call 911.
Actually, there is a study that recently published in a stroke journal to quantify the importance of time. And it showed that each minute a stroke is untreated, about 2 million cells, nerve cells in brain die. Of course, we have billion cells in our brain, but each minute about 2 million nerve cells die, and even 7 miles of nerve fiber will be damaged. And if stroke is untreated for 1 hour, is equal to brain aging for 3.5 years.
Wow. And I know the
Yeah.
medication is very powerful, that it can actually bring you back to almost normal, right?
Well, the idea behind the medication is to break up the blood clot and bring back the areas of brain that are at risk. There are parts of brain with the stroke that are injured immediately and are not going to come back. But what we know from the medication is that 3 months down the road, people are doing better than they were without it. So they don't have the misconception that it just takes away the stroke, but it can make people do a lot better than they would otherwise without it.
Let's also now talk about how to prevent this. I mean, obviously, it affects everybody.
Same as everybody, recommend, prevent, overweight, diet, there are studies show Mediterranean diet, more fruits and vegetables, helps to prevent a stroke and heart attack. Physical activity, moderate exercise, at least 30 minutes a few times a week. Reduce smoking or stop smoking. Avoid excessive drinking.
So if you take care of yourself well,
Yeah.
you should be able to reduce your risk for a stroke.
You can certainly reduce the risk. Again, there's age and the things that you can't control, and some people just have bad genetics. And there's no easy way. It's all the hard lifestyle things, but they really can make a big difference.
And so the key thing here is that if you know your warning signs, call 911 immediately.
Yeah,
Definitely.
time is brain.
All right. Now, if you'd like more information about MidState Medical Center, all you have to do is log on to midstatemedical.org. Thank you both for being here. So much information.
Thank you
And
for having us.
Thank you very much.
You likely saved a life today.
Thank you.
You're welcome. And coming up next, we'll talk about the benefits of clean eating and show you the perfect meal for post-training. But first, take a look at this.